Do you have a few minutes to chat with me?
Meet Anna, an AI healthcare agent designed to communicate with patients of WellSpan.
Hi, thank you for choosing WellSpan Health.
Anna is being used to pre-screen patients before appointments and to conduct healthcare surveys. Lori Gordner was called by Anna to take a survey.
Anything AI concerns me, because where is that information going?
Lori did not end up taking the WellSpan survey she was contacted about, exercising the caution that many people seem to have for AI.
Ultimately, it's very fuzzy in the mind of consumers. It means that there is ultimately a platform for education.
Kimberly Marsh and Tara Tyson recently conducted a survey of 1,000 people for the Harris Poll. Their goal, to determine consumers' views and perception of artificial intelligence as it becomes a greater part of our everyday life.
There is an openness among American consumers to AI, but they're not ready to fully embrace it yet.
When asked about their overall opinion of AI, consumers in the Harris Poll were about as divided as you can see from right here. 30% favorable, 40% neutral, 30% unfavorable. And their level of trust in AI, a slight majority indicates that they do not trust artificial intelligence at all.
They're not, kind of fully there with how this is going to be incorporated into their lives, why they absolutely have to have it.
When it comes to customer service, a clear majority in the survey, 74%, say they would rather talk to a real person instead of AI. On my Facebook page, I conducted an informal survey, and an overwhelming majority who responded indicated that they wanted to deal with a human and not AI. But a few people did indicate a willingness to try dealing with AI as long as they are informed they are not dealing with a human.
You can see in the emotional component of the data that there definitely is curiosity, there is this openness, and they want to learn more about it.
We've actually spoken before about getting caught up, and I'm pleased we're moving forward.
With more on how this new technology is actually being used by WellSpan, here's my 8 on Your Side colleague, Susan Shapiro.
Hi, thank you for choosing WellSpan Health.
The voice sounds almost human.
I'm Anna, your WellSpan Care Team's AI assistant.
But Anna is an AI assistant at WellSpan. The healthcare system, along with the company Hippocratic AI, rolled out the phone-based conversational AI in September as a way to reach out to patients, like Lori Gordner.
I think it could be a good thing, but I think they need to notify their patients that they're using this as a tool.
In a recent community healthcare survey using Anna, WellSpan exceeded its response goal by 275%.
Have you heard anything about the risks of colon disease?
Chief Innovation Officer Mark Kandrasad, who's also a WellSpan patient, let us listen in on his return call to Anna about colon cancer screening.
Can you tell me if you have any family members who have ever had colon cancer?
I know that my dad's brother is much older than him, and he did have colon cancer.
I'm sorry to hear that your uncle had to go through that. Can you tell me how old your uncle was when he was diagnosed with colon cancer?
The information and the call are recorded.
Stored securely, just like we store all of your other information. We are responsible for that. So your identifying information is not stored with the technology partners.
The Hospital and Health System Association of Pennsylvania says next year and each year through 2032, Pennsylvania will have a shortage of around 20,000 nurses and other healthcare workers. It says AI is one tool that could help alleviate the workload on nurses and other healthcare workers currently on the job.
It takes some work away from our staff members who are already really working hard, and so they can concentrate on the patients who are right in front of them.
Can you please tell me your date of birth?
Anna speaks multiple languages, is trained in all facets of medicine, and has all the time in the world.
That's completely understandable, Mark.
But experts say the human touch will always be needed in healthcare, especially when delivering bad or challenging news. Susan Shapiro, On Your Side, WGAL News 8.